Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right quadrant. The upper right quadrant, there are quite a few interesting things. We've got very poor quality bone. We've got a canine, a second premolar, and I think this would be a second molar, which are just BTRs left. We've got a very interesting thing. We've got this a very radio opaque thing which looks like it's metallic in nature, right here, which is slightly extending into the parrot and the parietal surface of the buccal side. So we are very interested to find out what this is. It's radio opaque on the x-ray. On the 3D rendering we can see that it's extending all the way into the sinus right here. It does not seem to be of tooth origin, so it needs to be investigated about what this might be. Now moving to the panoramic view. On the panoramic view, we can see we've got a canine. We've got second premolar, which is edentulous area. We've got this. The first premolar is edentulous. The second premolar is BTR. The first molar region is absolutely no bone whatsoever, and we've got an extremely pneumatized sinus as well. On the transaxial view, this is basically the proximal view. On the proximal view, we will be able to show you that this is the canine. The canine has a periapical delucency, which is perforating the cortical plate on the buccal side and is also causing dehiscence. Although, if extracted atraumatically, immediate implant can be attempted, but we would highly discourage it because of the quality of the bone and the infection here and the chance that the buccal cortical plate might fracture at the time of extraction. Moving to the first premolar region. In the first premolar region, we've got an edentulous space which is measuring approximately 5 millimeters in width and 8 millimeters in height. This area has a slight BDR which is present right here from the previous tooth. So this will need to be removed prior to implant placement. Now moving to the second premolar region, this tooth also has a periapical infection causing a cortical perforation and dehiscence of the bone. Here also we've got approximately 9 mm of bone width with approximately 7 millimeters, or you can even go to 8 millimeters in bone height. But once this tooth is also extracted, immediate implant placement will be slightly difficult. This is that extremely radio opaque material. We did not figure out what this might be. It's not directly into the sinus, but it is parietal, and it is underneath the mucosa. This is the mucosa where we can see. So we would be really interested to figure out what this might be. And then moving on, we can see that there is extreme sinusitis in the right sinus, especially that can be seen on the CBCT. Showing you the region of the 6. So this is the region of the 6. We've got absolutely no bone whatsoever. We've got a perforation of the parietal cortical plate. So in the region, and we've got extreme sinusitis. So in the region of the upper right 6, no implants can be suggested, because until unless the sinus is cleared, so a lateral sinus window technique cannot be done. The internal sinus lift cannot be done either. We've got very limited bone height. Approximately it's probably just a millimeter of bone, so implant placement in the top right molar region is going to be absolutely impossible. Moving to the upper right second molar region, we've got root PTRs again, which have periapical delucencies, which are causing external root resorption as well. So we would love to create an implant planning report, but this will need extensive extractions and bone grafting. And in the current scenario, implant placement seems to be very highly unlikely. If there are any further questions, please feel free to reach to our team. Just to give you an idea of the sinusitis, this is the sinusitis that can be viewed. This is the right sinus, this is the left side, and if we can take our doctor, so this is the region of the 6, and you can see that the left sinus is still better as compared to the right, which has absolutely no sinus places, and this sinusitis can be seen all around.